Welcome back, Dr. Conklin. I'm so happy to have you here. You're an expert in the field of psychology. I hear you and see your papers on menopause and also the intersection of race, menopause, and psychology too. I feel like you're just a whole expert in many things, but I'd love to chat today about perimenopause, menopause, and psychology and where we see things start to intersect for women. So thank you for being here.
Thank you for inviting me back, Dr. Cope. It's nice to spend my morning with you.
Likewise, I know, and I'll be just sipping on my coffee. But yeah, where did you see things start to pop up during perimenopause and menopause from the psychological perspective?
It's pretty broad, and it depends on the person. I'm going to kind of start with, how the physical changes.
Okay.
And how those physical changes impact women's mood, or anxiety.
Yes.
And how they just feel about themselves overall. So, a lot of women, I would say, come to me because they just do not feel the same.
Yeah.
Because there's all these hormonal changes, and, they feel like they can't mentally function the way they could function before, or can't even physically function the way they used to function. A lot of women talk about low energy.
Oh, that's interesting. Yeah. I hear that a lot too. Lack of energy or just not being able to quite keep up with their life the way they usually would.
Right. So all of these things, and I've listened to many of your podcasts and
interviews. Thank you.
And a lot of the things that you kind of bring to the table with other people you interview, those things impact a woman's mental health,
Absolutely.
For instance, sexual health. I know that you're definitely an expert in sexual health, and
Thanks.
the low desire or no desire, or just the physical changes in their bodies, and they just don't feel, being intimate just doesn't feel the same.
Yeah.
So that will take a toll on their mental health and relationships and, self-esteem. And I would say even attractiveness. I don't feel
like self-image or body image. Okay.
Exactly.
Yes.
Or even a few gray hairs and wrinkles, lines,
right.
Not being as toned, or the weight coming in the midsection. Like, gosh, how do I get these extra inches off of my waist? And I can't fit in the clothes I used to fit in, and so I'm just saying it's so complex is what I'm
You're
really
right. There's so many things that add on during that time. Whether you're a person who's experienced depression or anxiety or other, mood disorders, anyway, all of those other things just kind of build up.
Build up and affect the women's self-esteem, especially if they don't know what to do. And they feel really lost and, gosh, am I ever going to get back to who I used to be? And I'm missing that person. I miss, being able to just jump up out the bed in the morning, go for a run or go do this or go do that. Or, I'm an executive at whatever company and, I need to be, thinking quick on my feet and whatnot. Right. Here I am sitting in a meeting drenched in hot because of hot flashes.
Right. Or experiencing brain fog, right? This is a thing I keep seeing for my patients who do have high performing jobs, that the brain fog makes them feel like a new sense of, I guess, lack of confidence or worry or anxiety, even over presenting or performing at work, that their mind is going to go blank or that they're just going to be thrown off. And then even, you're right, self-worth takes a hit.
So when you're talking about the presenting, the tip of the tongue phenomenon, I was like, gosh, I know that word. I can't think of it. I know what I'm trying to say, but I can't really pull it together. And so there's this sense of embarrassment and maybe, gosh, I hope no one noticed that, and, because then now we're talking about these things making women anxious.
Yeah.
Or feeling down, even if they didn't have anxiety before.
Right.
Or depression before.
Yeah.
Because I know this kind of comes up as well, I've never been anxious before, but now I seem to be so anxious all the time. Or I never had depression, but now I feel down.
Yes.
And I don't know what's going on.
Yeah.
And it's more when I see it from that perspective, it's more like an adjustment. There's
Right.
something in our diagnostic Bible, adjustment
Hmm.
disorder,
That's right.
and is adjusting to these changes that they're seeing and that they're feeling, and knowing that it's not all in their head.
Right. And having to deal with that adjustment or this transition, right? Like, I feel like I have gone through different transitions. If I think about my career or my life, when you move somewhere new or you start a new job and kind of how that feeling of unease or like you don't yet feel secure in your situation because you're still figuring it out, right? And so the transition of perimenopause and menopause, if you don't feel like yourself or you have these new symptoms that are popping up, like, and they're going on for 5 to 10 years, I mean, I can't imagine that feeling of unease for such a prolonged period. We got to offer some solutions to people.
Yeah, and then that's kind of to me where that I'm glad you brought that up because, okay, so menopause is this normal transition.
Right. Right.
So it's a lot of times dismissed because it's a normal transition, you
Yeah.
know. But in fact, like you said, if it's affecting someone 5 to 10 years, then
Yeah.
we need to offer some type of support. And now I believe, like the Menopause Society has something that they're working on, and I
Yeah.
can't remember exactly what is the exact name, but
Okay.
about how to,
Oh,
present
in the
to
workplace or no?
how to present like to those at our place of employment who can
Yes.
offer some support for women who are going through menopause, whether it is just a room to just go take a break and meditate or cool off, just like there's lactation rooms.
Yes. Yeah, that's exactly what I was thinking. When you do look at these other big milestones for people or these times of transition, like if people move into a new house, we throw a housewarming party for them. Or like when people are growing their family, we show up and we help them. But menopause and that sort of transition, what are we doing to support women?
You have to have I think, a company who's very aware and
Yeah.
sensitive to the needs of women going through perimenopause or still having a hard time post-menopause, and to be able to educate them and recognize,
Yeah.
that these symptoms are impacting their work, because there is, and Rachel, I wish I had the numbers for you, but
Oh,
there's
that's
a higher percentage of women, retiring earlier
oh
or
yeah.
leaving the workplace because
Yes,
of it.
absolutely. Yeah, actually I did an episode on that with a couple of lawyers. And so if anybody wants to listen to it, you can go back and find that. It is really interesting and it's striking the number of women who just leave the workforce during that time. And not to mention the other burdens that might be happening. Women going through their midlife tend to be in that sandwich situation, right? With the stress of their aging parents and potentially their children. Like that also must compound their mental health.
Oh, absolutely, absolutely does. I know we kind of like, talked about if someone never has been anxious or never had
Right.
depression. And I don't want to forget about the women who have had this, chronic depression
Hmm.
or even bipolar disorder
Yeah.
or what's called generalized anxiety disorder, which is just a general worry about many different things, hard to shut their mind off.
Hmm.
And then, so those symptoms can exacerbate, like the anxiety is more intense, the depression is lower,
Right.
and
Right.
or
Yeah.
even I think that this rage sometimes
Yes.
that women feel,
Hmm.
and the impact that they feel that has on their relationships with their families, more at work, is like lower frustration tolerance.
Yeah, you're right. Because you are having like lower drops in a way. That's kind of how I explain to my patients. If you're having fluctuations of estrogen, but you're going through menopause or perimenopause and your baseline is lower than it was ever before. So you're just having these lower drops in hormones, whether it's estrogen or progesterone or even testosterone. And so that you're right, like it creates an intensity. Sometimes I try to reassure my patients that, hey, men are walking around like this all the time in these low states. And all of these, this is just, I feel like it's the change from their baseline. Like you said at the beginning, not feeling like yourself or not feeling normal, right? And lots of people kind of just operate at this lower baseline and may not notice the differences, but it's that fluctuation, it's that roller coaster of perimenopause that I think makes it so hard.
Oh, absolutely. And then, like, so let's say what contributes to that roller coaster is stress.
Yeah.
And let's say we got a deadline or you got a lot of notes to do, in
Yeah.
our field, we got a lot
Yes.
of documentation we
A
have
lot.
to attend to in
Yeah.
addition to, taking good care of our patients. But, then you have to run home and do whatever you have to do, or, and like you said, if there's a sandwich generation, you're taking care of your, parents who may not be doing so well and
Yeah.
taking care of your kids, perhaps if your kids are adults, which they most likely are, you may be taking care of your grandkids. That's a
Right.
possibility,
Right. Right.
And so trying to do it all, get things done,
Yeah.
trying to manage your own health, because exercise tends to go out the window, not for
Absolutely.
everyone, but for a lot of people it does. And
Yeah.
how do I do all of these things and, I don't know, stay balanced,
Yeah. Take time
centered?
for yourself, right? It's just not possible.
Yeah, makes it just more challenging.
Yeah. And okay, I wanted to ask you another thing because do you see patients who come in with like attention deficit or ADHD or ADD?
I
And
do.
okay, so I have kind of been thinking through this because I had a patient who had pre-existing ADHD and is going through perimenopause. And she said, I hadn't really been taking the medications for a while, wasn't really needing them just for day-to-day functioning. But then I noticed as I'm going through perimenopause that if I take my medications, my brain fog is gone.
Mhm,
And she
mhm.
said for her, brain fog is the same as ADHD. And this is the first time I really thought about that because I'm like, is it that the brain is being distracted by other things, or is it the stress that's distracting the brain? I mean, I don't know the science behind it to be totally transparent, but it did kind of change my mind. And maybe I should be offering treatment for ADHD for women who are really struggling with brain fog. Or is it, I don't know, or are they different? I'm not sure. I just wondered your perspective if you
No,
see.
that's a good question. And matter of fact, that's the first time I've ever been asked this question. And so when a woman has, let's say she does not have, this ADHD diagnosis, but it's this brain fog, hard to concentrate, but it's also, partly language, being, having a hard time recalling certain names, words, maybe
Walking
even
into a
remember.
room not knowing why you walked in there.
Right. Yeah. It's like, how did I get here? And an ADHD, it's a bit different. I mean, they're still both having a hard time with concentration,
Yeah.
but maybe for different reasons. So, but it's still something to kind of think about, if
Right.
that will help with brain fog or not. I think maybe that's something, you are, you, you're a researcher, you do a lot of
Thanks. Okay, so I need to look do another. I would start another research project.
research.
No, I mean, it was, this is the thing. I learned so much from my patients. I get my research ideas from my patients because you start to see patterns or certain phenomena that we haven't quite explained. And I feel like brain fog is one of the trickiest things because I do have many patients who feel better once they are using hormones because then they might be getting sleep better. They're feeling more alert during the day. And so I think their memory is firing, a little bit better.
Mhm.
But I have plenty of patients who are on hormones and still experience brain fog. And it's tricky to figure out what to offer them.
Well, I can tell you just from my perspective, other things that will affect brain fog, and this is like pretty standard in terms of just memory in general.
Okay.
So it would be more anxiety, hard to
Mm,
remember things if you're highly anxious,
okay.
depression,
Hmm.
significant stress, or especially
Okay.
if it's chronic, or as you were saying, just poor quality sleep. All of those things impact, I think, the memory, the forgetfulness, and so even like, let's say they're taking something for the anxiety or
Mhm.
depression, or even just managing it using coping skills, that
Yeah.
still is going to help them to
Okay.
manage the brain fog. It's not going to make it go away,
Right. Right.
but they can get a little more control
Yes.
over it.
Okay. I send patients to you for that reason too, because I feel like if my patient whose mind is blanking when she's about to give a presentation, if you can teach her a coping skill of kind of what to do in that scenario, so then she doesn't just unravel and, become more upset and then not be able to kind of find her bearing, then yeah, that should be hugely helpful for her.
Yeah, absolutely. And, there's so many, things on the market. And I know, I don't want to really get into a lot of supplements and things like
Sure.
that. 'Cause that's really technically not my area. But,
Mhm.
there are other things out there that can help with anxiety. And,
Yeah.
especially if women are real sensitive to medication. So some women
Oh,
really
yeah.
are, or just don't just flat out do not want them.
Right. Well, you and I work together on supplement MIM. I think it's totally fine for us to talk about it because, it's different from a prescription medication. And, full disclaimer. So Danette and I are clinical experts in a supplement company. And one of the supplements is ashwagandha, which helps a lot of women, right, with their anxiety, whether it's during the day or at night. And I think we have a lot to learn from other cultures. People have been using that in India for a very long time. And so I think you're right, especially if someone does not quite need a prescription or might be sensitive to a prescription. There are some good things out there. The other ingredient that I love, and I don't mention this necessarily to my patients because of the conflict of interest, but in general, I feel like the mango leaf extract that we put in the daytime formulation, I love that stuff. I have taken that myself by itself, just the Dynamite, and it's been used throughout Asia for centuries as a tea. It's like a non-stimulant stimulant, so just kind of like helps you feel awake without making you feel wiry.
Hmm.
So, yeah, you're absolutely right. There are other things too that we should be looking into and researching and trying to figure out if that could help.
Absolutely. And like you said, staying awake without worry. So then if
Yes,
you're awake and you're alert, but you're not worried, that means you can focus better,
right. Exactly.
and then you can get things done.
Yeah.
Because I know what, if I'm worried,
Yeah.
I'm bouncing all over the place, like the Winnie the
Yes.
Pooh, Tigger and Winnie the Pooh.
Just boing, boing, boing.
Exactly. Things are getting done a little bit here and there, but I'm really not completing anything,
Yes, I know that feeling. Yeah.
and I'm just all revved up, and it's the energy's there, but it's really hard to get things done that way. But so, like you said, some of the MEM products, what we have in the MEM products, if we can help people stay alert, give them a little more energy, bring a sense of calm, because
Right.
the sense of calm is really huge. Because let's say, like we're talking about with stress, and that increases hot flash frequency or hot flash bother, and it can actually help them to be able to implement these coping skills. And I think that's kind of like where the compliment comes in,
Right.
either
Right.
having a supplement and coping skills or having a medication and coping skills,
No
especially.
matter what, coping skills is a good idea.
Yeah, it's a very good
Yeah,
idea,
absolutely.
you
And I
know.
love that there are psychologists like you that teach those, right? I think for people who don't live in the Cleveland area and don't have access to you, what kind of psychologist should they be looking for? Where should women be looking for help?
I would say the first thing I would suggest, and I have suggested this because I'm in a clinic where people travel and come to the hospital. I give them the information to the Menopause Society website.
Nice. Okay.
And I say, look to see if there is a provider in your area, because there's psychologists on that
Oh,
site too.
yeah. Yeah.
And then and even if there's not a psychologist, say that, there's someone like yourself in whatever state they're in, then you could say, oh, I know someone.
Right. That's
Go
right.
to.
We do have kind of our networks of people that we rely on and trust.
Yeah, I suggest women start there. But let's say, if they're in an area where it's just not, the access is just not that great, just find somebody who can just help you manage the stress, the anxiety, the depression, or the mood swings. And just in general, they may or may not have a lot of information about menopause itself,
Yeah. Yeah.
but, if at least if they can help you manage the symptoms, that's still a bonus, I think.
Definitely.
Um,
Definitely. Okay. My last question for you, because I know we could talk all day, but my last question for you is about perimenopause, because I do think that mental health issues sneak up on women during perimenopause. And sometimes, whether it's the person herself or her healthcare providers or whatnot, the dots are not always connected. And I just wanted to hear from you, like, what are some early signs that, okay, this might actually be influenced by perimenopause, or here's where you should be kind of thinking, do you need to adjust both the perimenopause and the mental health concerns?
You're asking, I just want to make sure I'm
Yeah.
understanding the question. Like, what are some initial symptoms or signs
Hmm.
that I see or that I could tell a woman to look for?
Yeah, exactly.
Okay. Well, I would say the first thing would be, if there's any significant changes in mood
Hmm.
compared to their baseline.
Okay.
And if it's someone who already has depression or another mood disorder, does it feel a little bit different than it did before? Also, if there's any sensitivity to if their menstrual cycles are longer or shorter or heavier,
Interesting.
or if they skip
Yes.
cycles, if they're
Okay.
noticing any changes in how they're functioning mentally, or emotionally, then those would be then I'll say, just, go talk to somebody so you know what to expect
Yeah.
and know how to maybe even, start to manage these things so you don't start to feel way out of control,
Yeah.
you know.
Okay. Yeah. No, that's a really good point. And you kind of made me think of something. In order to recognize those changes, people have to be tuned in with themselves. And I feel like to be in tune to your mental health, you kind of have to quiet all the noise around us, right? Like there's so much noise, there's so much distraction. And so to help people even recognize what a change is happening, it's like you have to then be able to tune in to your own self or have a very trusted partner who can let you know without offending you.
Yeah.
Things
Yeah.
feel different to me.
That's a good point because a lot of times, like you said, there's so many multiple things going on and there's so many distractions. I mean, just the phone,
Yes.
you
Yes.
know, that maybe we're not as tuned into ourselves as usual. But so let's say, for instance, if they're already seeing a therapist or seeing someone like myself, I mean, I can certainly ask, has there been any significant changes in how you've been functioning since we met last time?
Yeah.
you know that could be of help, and if there's a good relationship, a good bond, someone like myself can bring it up without the person being offended.
Right.
But the kids would bring it up.
Yeah. Oh, okay. That's good to know. Keep that in mind.
Your kids would be like, "Mom, what's wrong with you? What's going on? I didn't do anything."
Oh, that's so funny. Yeah,
And they're like,
that's funny. I have heard some of my patients talk about that too.
"Hmm."
Yeah. Yeah, that's so funny. Or noticing that they just don't have the same tolerance or the patience with their kids that they used to. And they're like, yeah, that's so interesting. But we have such few moments without the distraction of a phone or something happening. I feel like I'm trying to think of, all these times where maybe 20 years ago it would have been just like sitting and waiting for someone, where you have these 5 minutes where you're waiting for someone to jump on or not even jump on. See, my brain has changed. Since the pandemic. Say you're meeting in person with someone and they're running 5 minutes late and you don't know because you don't have a phone to know what's happening and you're just waiting, right? And you just start thinking about things and you have this brain space or being in the car and all the radio stations are playing music that you don't like. So you turn the radio off. You can't just select what you want to listen to or put on a podcast. There's all these sort of liminal spaces that we don't have anymore because we just fill it with noise or with distraction. And I don't know. I feel like for mental health providers, I'm sure you could see the difference between the worlds then and now and how people know themselves or don't know themselves.
Mhm. I think, one of the things that I would say typically suggest is that self-care time. And
Hmm.
I would say the response is normally, I don't have time. I don't have time.
Yeah.
Okay, well, and this is pretty standard. This is not just, relate to menopausal women, but just
Right.
kind of look at their schedule, really take a hard look.
Yeah.
And what can you cut out that's not
Yeah.
necessary? And you can pencil yourself in. And I think to help, women to take time out, they really literally have to pencil themselves in into their
Yes.
schedule,
Yeah.
whether it's, meditation, taking a walk, some type of exercise, or even just kind of like going hanging out with their friends,
Yeah. That's
whatever
true.
it is that brings a sense of groundedness and peace
Yeah.
and stillness. Because,
Yeah.
the stillness is really important because if you have that stillness, then you can tune in.
Yeah. That's a great point. Yeah. We need more stillness. My last point I want to mention on that is, I'm actually having her on the podcast soon. Sunday Schneider-Bean has been my longtime life coach, career coach. She's amazing. And one of the things that she says when you're scheduling your month or your block of time, that you should schedule in what your priority sort of self-care stuff is, whether that's exercising, meeting up with a friend, whatnot, and put that on the calendar first because everything else is going to get done.
Yeah. Or
But if you
not.
don't,
Who
right,
cares?
or not, yeah, right, or it's not as important, it'll fall off. But if you don't schedule that in first, then you won't be able to find the time to squeeze it in. So you just kind of like put these blocks of time. Okay, I'm not professing to be good at this. This is something I still have to work with her. But I do think it's a really good recommendation to put these priorities into your calendar before putting everything else in. Otherwise, it's not going to fit, right? Because
Oh,
there's
absolutely. Yeah.
limitless other things to put on there.
You can go to any store that sells journals and get you a
Yes.
little journal. And, if
Yeah.
you have to do it that way, put it on a whiteboard, put it on your phone if you like it that way. There's so many ways now to
Yeah.
remind us that,
Yes.
oh, appointment at 9 a.m. Oh, it's for me.
Oh, that's awesome. I would start doing that. And then you don't join on to everything or you don't do all the other things that people ask you to do at the last moment because you're busy. You got a conflict.
I'm gonna go out and sit in my lounge chair with my, glass of, I don't know,
Yes.
whatever you like.
Right. Exactly.
Sit by the
Exactly.
pool.
Exactly. I know. We need more of that in our lives. Okay. Well, I'm taking that from an expert mental health provider. We need a scheduled self care and time for ourselves and time to think and time to tune in, especially during these times of transition of perimenopause and menopause.
Absolutely.
Thank you, Dr. Conklin. As always, it's a pleasure. It's so good to talk to you.
You're welcome, Dr. Pope. I hope you have a good day, and I hope you put yourself on your schedule. If not, I hope that's the next thing you do.
Thank you.